What an amazing experience we are having so far. I want to say thank you to each of our faith leaders, to our sponsors, and to our keynote speaker who really provided us such rich and powerful and moving, compelling words of inspiration and welcome. And I want to continue to invite you all of you who have joined us right now, to submit your own recommendations in our question and answer feature at the bottom of your screen. What do you think we should be doing to meaningfully address our 4 key components to ending HIV globally? I want to share for you some things that I heard in particular that really stood out for me. I heard from our faith leaders who prayed that we do not have the luxury to be overcome by defeat and by despair. We must act. Winnie Barima of UNAIDS mentioned that there were 3 key lessons that she had learned over the last 40 years from fighting HIV/AIDS globally. That 1, it's going to take global solidarity to solve this problem. 2, that the pandemic, HIV, and other diseases are not just medical, but it's an all-society approach, and it's also an all-society touch point. Thirdly, she mentioned that human rights must be at the center of all of our efforts. We must value all human beings. We heard from Jesse Mylan, who told us and reminded us that God is speaking through us through the HIV/AIDS epidemic, and that we understand what God is expecting of us. And as the Negro spiritual rang true then as it does now, that God is troubling the water. God is troubling the water. We are so fortunate to be reminded that when our faith is shaken and when our communities need our faith leaders the most, and we need our moral leaders to stand firm in this moment. Mwafa Sopa reminded us that the H in HIV is for humanity, and that we must also consider always the importance of people living with disabilities and the impact of HIV on their lives, and vice versa. And Archbishop Makobo said that faith communities want to be a part of our government and other organizations, not merely for our own sake, but that we also are called to serve the vulnerable. We are called for new models of private-public partnership at the national and international level, and called for 5% of the global funding for the increase for the global funding around HIV and AIDS. This was a truly remarkable and impactful opening session. And at this time, I want to say thank you again to all of our faith leaders and our speakers for the opening session, and introduce the first session of our day, entitled Ensuring the Provisions of HIV Services During COVID-19, Best Practices by Faith Groups. And I want to encourage you to, as you're listening to the conversation, please submit your comments, your recommendations. We have a few coming in now, and I'll read just 2 of them before we transition. And one person said, we need an integrated and holistic approach in fighting the HIV pandemic and other disease and social ills that threaten all humanity. That's a beautiful statement. We have another recommendation that stigma with COVID brings up the memories of stigma with HIV. As Mr. Mylan said memories of being afraid to not be the next someone who is positive, the mask, the gloves, all these images of the COVID-19 response are rememberative of those from the HIV early response, and that we have so much to do, and faith leaders can take our lead in this epidemic and effort. Thank you once again. Continue to put your recommendations into that recommendation question and answer box so that we can hear from you and we can embed what you think into our solutions. As we listen now to the first session entitled Ensuring the Provisions of HIV Services During COVID-19, Best Practices by Faith Groups.